our communication officer colleague who is also deployed in Gaza. With me also we have Dr. Teresa Zakaria. She is the incident manager, the HQ incident manager for the conflict escalation in Israel and the occupied Palestinian territory. Now, without delay, I would like to give the floor to Dr. Peeperkorn to give us some opening remarks, and then we will ask Dr. Thanos to also say a few words, and then we will open the floor to your questions. Thank you. Dr. Peeperkorn, you have the floor.
Thank you very much. I hope you can hear me well. Greetings from Gaza and also greetings from my team, and including Dr. Thanos, who is actually just behind me in the jog. So I think we are based in Rafah, and we've made some missions, which we also discuss about a little later. But of course, all eyes are currently on Rafah. We all watch the news, and we all get the stories about this possible incursion and military activities getting closer. It gets closer, but actually a military incursion into Rafah. I know this place very well. I came here every month in Gaza for a week or two, and this is normally a very sleepy town of 130,000 people, and currently there's more than 1.5 million people cramped in an incredibly small place. Everywhere, makeshift shelters, UNRWA shelters, etc., all over the place. Incredibly small. We include, of course, most of our extremely concerns. So what's happening and what's going to happening, and you feel that, you see the fear in people's face. People constantly come with questions. What is the contingency plan? What can we do, etc. What I really, and I think it has been raised by many before me, and military activities in this area, this densely populated areas, would be, of course, an unfathomable catastrophe, and an enormous, would even further expand the humanitarian disaster beyond imaginations. A new wave of displacements and would also really give an increase in, of course, in additional injuries due to the military offensive and trauma. It will wreak havoc among the civilians who are already mentally scared and traumatized, but it will also increase the burden on a completely overburdened and undercapacitated health system on its knees, and increase the trauma burden, and it would push the health system closer to the brink of collapse. In this area in Rafah, there's only 3 hospitals partially functional, and I'll get back to that. So there's actually a relatively small hospitals. They're supported by 3 small field hospitals. We're talking about 450 beds, and that's already now absolutely not sufficient for the needs. So hospitals completely overwhelmed and overflowing and undersupplied. The health workers needs actually they need a relief. Many are cut off from their families. I want to say something about that shrinking humanitarian space that's been raised constantly. The repeated access restrictions and denials, they continue actually to obstruct delivery of humanitarian support. And as WHO and the UN, we are ready to be actually doing much more all over Gaza. So since November, only for WHO, 40% of our missions to the north, for example, have been facilitated. Only 40%. Since January, the figure is much lower. So all of these missions have been denied, impeded, or postponed. And approximately 45% of the mission requests for the south are facilitated. That's absurd. Even when there is no ceasefire, a humanitarian corridor should exist, so that's WHO, the UN, and parties can do their job. We need a complete, a pragmatic and a different deconfliction system to be able to actually do our work. The UN, WHO is ready to carry out many more missions, both to the north, to the middle area, and to the south, which we cannot do now. When you look at the attacks on healthcare, we are, of course, gravely concerned, and you've seen this in the news, is about the situation around Nasser Medical Complex. Nasser Medical Complex is what we used to call the Shifa hospital from the south. It had all the specializations. And currently, civilians have been called to evacuate, which is extremely dangerous. The hospital has been reportedly under siege for more than a week now. 10 civilians reportedly killed. And there's also reports that the northern gate being demolished and 2 of its warehouses being almost destroyed due to hostilities. If that's true, because we don't know, we don't have access at the moment. If that's true, also when you look at the warehouses, that warehouse is important not only for Nasser Medical Complex, but for other hospitals in the middle and the southern areas as well. Not only WHO, other partners, etc. We've provided for hundreds of thousands, maybe together, maybe millions of medical supplies and goods in that warehouse. So access is obstructed and we are unable to reach the hospital. And the last access was actually 29th of January. In the past 5 days, WHO and we put in 2 mission requests for assessments and to resupply with the required medical supply and trauma supplies. Both have been denied. So without this support and without actually being able to access, and this hospital might become non-functional too. And we have seen this actually too often. We've seen this, of course, in the north. This cannot happen in the middle area or in the south. And just coming back to that, yesterday we were in Al Najjar hospital. That is the key hospital in Rafah itself. Al Najjar was not supposed to be a hospital. It was supposed to be a primary healthcare center. It became a hospital, small hospital, 65 beds. Currently, over 300 patients, and you see the same pattern in all the other hospitals. And 15 to 20% of the patients who can be discharged don't want to be discharged. They refuse to be discharged because they have no way to go. Overflowing trauma wards and people being treated and ECGs, etc., done on the floor. The trauma wards, every space is occupied to actually harbor patients and beds. So everywhere there's medical patients. That hospital has already shifted their pediatric ward to another hospital. And also Al Najjar Hospital, they're afraid that when a military incursion will come, it will come to their direction, and the same thing will happen. They're afraid that the same process will start as what's now currently happening in Nasser Medical Complex. Because I want to explain it again. It's not only about direct attacks on the hospitals. It's also about military activities close to the hospital. Patients, ambulances cannot access, patients cannot access, health workers cannot access, WHO and partners cannot bring supply, and very quickly the hospital, from being partially functional, it becomes non-functional, barely functional, and finally out of action. Now, without support, the hospital could become non-functional. And with regard to Nasser Medical Complex, we also want to call on all parties to make an effort to prevent this from happening. Hospital must not be militarized. My last point I want to make, I know I'm talking too much about health systems overall. So we constantly supplies, but the needs are enormous. Another example of that, yesterday we were also to one of the field hospitals from the and well-functional field hospital here in Rafah, 70-bed. They started the hospital and they expected that they would receive 200 patients a day. Very quickly it became 600 to 700 patients. And the last couple of days, they saw a decrease again to 400 and 500. That was because there were, as you know, bombardments in Rafah and a lot of 67 deaths, and a lot of people, again, scared, people on the move, moving away, etc. So they saw less patients. They are also, they raised their anxiety is enormous. But they got shrapnel very close to their field hospital, and the anxiety is very huge because that hospital is another lifeline, and just the same as Al-Najjar, can only refer patients to the European Gaza hospitals, more complex patients with need a CT scan, etc. But also patients where you actually have the intensive care units, care units, intensive care units in Gaza, and there were intensive care units in the complex. If lines, patients cannot be referred to the health systems is in tatters, and only 11 hospitals are north, 6 in the south, 3 visual CS hospital, Shifa and Nasser, who are not functional. Now, the
Dr. Peeperkorn, there are some connectivity issues.
More than 20 IDPs everywhere.
Dr. Peeperkorn, we are having some connectivity issues. We can barely hear you. So let's maybe try again with you or Dr. Thanos, or we can go directly to question from journalists. Over to you, Dr. Thanos, if you want to add anything to what Dr. Peeperkorn said. And journalists, sorry for that. We have some technical issues and connectivity issues. Bear with us, please.
Thank you very much. I hope my sound is clearer. I want to stress that right now, what we the system is struggling to, and one of the difficulties that it has to deal with is treating catastrophic injuries that lead to amputations. We all have to understand that there are amputations that happen because of amputations that happen because there's a lacking of a system in place. And when I'm saying there's a lacking of a system in place, I mean that we have health workers that cannot treat themselves every day to the work because their competing priorities have to do with making sure that their family has shelter, food. We have so improper follow-up patients from day to day, and in parallel, to save them, you need to be able to operate and reoperate the patient, reoperate, follow up closely, and or that you follow.
We
unfortunately
can't hear you
right now.
Yeah. The sound is very bad, Dr. Thanos. Maybe if you turn off your camera, it will improve a little bit. At least we can have the sound. Dr. Thanos? Okay, I think we lost Dr. Thanos. As I said, our colleagues in Gaza are having some connectivity issues, and We may want to try again, Dr. Thanos. If not, we will go directly to questions from journalists, hoping they can be able to hear us and respond to your question.
Yeah, I think we can hear you now. We can
okay.
hear you now again.
Okay, thanks so much. Dr. Thanos, do you want to continue what you were saying? You can keep going,
I
please.
think Dr. Thanos was for the moment finished. Maybe he will take questions. He will take questions.
Okay. So let's then Dr. Peeperkorn.
Apologies, our connectivity is poor.
Yes, yes, we understand, and thank you for making the time to brief journalists. I would like now to start giving the floor to journalists. We have several. Let's start with Nina Larsen from AFP. Nina.
Yeah. Thank you very much for taking my question. If you have notes, that would be very helpful because it was very difficult to understand much of anything that was said. But I was hoping that you could maybe say a bit more about the situation at Nasser Hospital in Khan Yunis. We have received testimony indicating that Israeli snipers have killed several civilians in the hospital courtyard. And I think you mentioned that there has been an order for people to evacuate. Could you clarify if that is from the Israeli forces and how that evacuation is proceeding? And we've also heard that the hospital is running out of food and drinking water. So if you have more details about the situation there, that would be very helpful. Thank you.
Dr. Peeperkorn. Yeah, we keep losing you. Maybe Dr. Zakaria can answer the question while we are trying to get back to Dr. Peeperkorn and Dr. Thanos. Dr. Zakaria?
Thank you.
I'm trying to see if Dr. Peeperkorn was able to join us once again. Dr. Peeperkorn, can you hear me?
Yeah. I got a question. So I think what we know about us.
Sorry, we can't hear you.
So what we know about it's very. I'm really apologies, but this is live in Gaza at the moment. So we know that civilians have been called to evacuate. The hospital has been reportedly on the siege now for more than a week. We all know that 10, probably more, civilians have been killed. Yeah, outside and even inside compounds. The reports of the northern gate been demolished, and two warehouses have been destroyed. That would be really, really bad because they actually have a lot of the supplies and equipment. Access is obstructed. Both were denied to resupply and actually to make an assessment. Now again, we put in a request to, as quickly as possible, to make sure that we can do a quick assessment and see how we can best help. So we call, of course, on all parties to make an effort to prevent this from happening. And hospitals, we call 3-level hospital for south of Wadi Gaza. It's together with EG, the European Gaza Hospital, and Al-Aqsa, they're the 3 referral hospitals. So it's actually potentially the most important. Just some other information, but based on the latest information, there's still 402 patients in Nasser Medical Complex, 35 on the dialysis, 18 on the ICU and ventilators, 3 neonates in the ICU, and 100 to 200 of what we call stretcher patients. So there are still 402 patients and staff in Nasser Medical Complex. Over to you.
Thank you, Dr. Peeperkorn. Let's go straight away to another journalist, Yuri Aprilev from RIA Novosti. Yuri?
Yes, thank you, Fadela. And we totally understand that there are problems in Gaza with connectivity, so no problem. Israel has accused the WHO of collaborating with Hamas and assures that the hospitals in Gaza have been used for military purposes for years, with the complicit silence of international organizations. Have you noticed that hospitals are used for something other than treating patients? Because when we are listening to WHO or, for example, ICRC, they are never speaking about that. We only know that there is patients and refugees. And what can WHO do in the face of repeated attacks and siege against hospitals, like this is the case in Khan Yunis? Because this is not something new. It was the same. It started at Al-Shifa Hospital, and it just gaining more and more and more hospitals. What can WHO do in this case? Thank you.
Thank you, Yuri. Dr. Peeperkorn?
Yeah, I think maybe also Teresa want to say something about that. Well, first of all, of course, hospitals should never be militarized and used for purposes as others are caring for people. Yeah, that would be wrong and indeed a violation of international humanitarian law or the laws of war. So workers to deliver supplies and support, do training, etc., for patients. Yeah, like here, have received no evidence of issues of hospitals. And again, I want to say, so we are not a crime engaging organization. We the World Health Organization.
All right, thank you. And I think this is a very, very pertinent question and linked to the first one. As Dr. Rik has mentioned, I mean, hospitals must be safeguarded and they should never be militarized. It constitutes by itself an attack on health facilities. So that is what we believe in and what we also advocate for. The same way that we advocate for hospitals to not be bombarded, ambulances not to be shot at, the same message would also convey that hospitals should never be used for other purposes than treating people, providing health services to people who need it. I think I can definitely not be louder in saying that no, there is no collusion between WHO and any other entities and the health sector and the health partners, Ministry of Health that we are collaborating with. We are not in a position, however, to investigate any other activities taking place in hospitals or what is happening underneath hospitals. I'm sure you can also appreciate that in hospitals where there are lots of patients, lots of displaced populations, when we focus on delivering services, that's really what we're doing. We're not in a capacity to look beyond that service provision that we need to fulfill. And I think that's really important to mention, that these hospitals are providing health services, and that remains the most important part. They're also used as safe havens for people who have been forcibly displaced, seeking refuge and security. And again, so back to my first point, that the protection of patients, medical workers, and also the civilian population remains the most important thing, and that needs to be more the headlines than anything else. I think that it is the message I would really want to point at. What can WHO do? Well, this is what we're doing as well. We're trying to raise awareness on the importance of safeguarding hospitals. We do have the mandate from our own member states, but also from even the Security Council of the United Nations. So we are obliged to monitor and to report on attacks on healthcare, be to the facilities, the militarization of facilities, the active attack on facilities, as well as patients and transport. And we do need your help to continue amplifying what we are reporting on. And again, the protection of patients, because these hospitals, regardless, are still providing health services. They're used as safe havens for those who have been displaced. That remains the most important thing. And their protection is the most critical thing that we need to ensure. Thank you.
Thank you, Dr. Zakaria. As you can see, the connectivity issue is still not fixed. So we will take one more question. And if the sound is very poor, I think we will have to stop this press conference. We will make sure to send you the notes. And sorry for that. And thank you for your patience. Now I would like to give the floor to John Zarakostas. John, you have the floor.
Yes, good morning. My question is to Mr. Gargavanis, Dr. Gargavanis. You mentioned due to lack of staff, you're forced to do amputations that otherwise you would do double operations to save people from losing their limbs. What is the ratio of unnecessary amputations that you're forced to do at the moment because of the lack of resources and staff? And do you have an update? In early December, we were told by UNICEF that we're over 1,000 amputations of children alone. What is your update on the number of amputations and the percentage that are unnecessary amputations? Thank you.
Dr. Thanos?
Here's Rik again. Thanos had to leave because indeed connectivity is, well, unfortunately really, really poor, and especially from his side. So he had to go. John, this is a difficult question. We don't, unfortunately, have that specific data, but I can mention it. So, Thanos, I was in Al-Aqsa Hospital. It's in the middle zone. It's in in the middle area. Just Sunday, we brought in supplies, and very important hospital, and doing everything. Then, when military activities surrounded that hospital, they went down to 5 staff, and they were almost non-functional. And now, again, it's a relatively quiet area, the Darabella area, and health workers came back, volunteers came back, etc. And they started up again and expanded their hospital activities. They simply said that with their medical specializations, they had a couple of general surgeons, etc., but they, for example, lacked a vascular surgeon. and that yes, that's occasionally they will have to do an amputation if because they couldn't refer, they could not. The medical evacuation is too poor. They couldn't refer a patient for them to get actually to a place with a proper specialist care. This is a problem. I want to stress that for all of Gaza. That was also when I was in the European Gaza hospital. Actually, that was with the humanitarian coordinator, James McCovery. We also had a quick discussion with the family and a young patient and a young girl with multiple burns, and she was typical a patient would need to be referred outside Gaza to get the right treatment. There's not a proper medical evacuation in place. It's all ad hoc and completely insufficient. And we've been pushing for this for a long time. We've made proposals for that, shared it with all the partners, etc. And it is simply not working. So that's another key request for anyone who can push that we get a proper medical evacuation. WHO, we estimate that at least 8,000 patients need medical evacuation outside Gaza. 6,000 related to 6,000 plus. It's an underestimation. 6,000 plus related to this conflict, all the multiple trauma, the excessive burns, reconstructive surgery, etc. And 2,000 medical cases, because before this conflict, between 50 and 100 patients were referred to East Jerusalem and the West Bank, and almost 50% was oncology cancer related. They have nowhere to go. So we talk about 20 to 30 patients sometimes a day, etc. It's way too little. We know that Egypt, they have offered support with the evacuation, and many other countries in the region and outside the region have offered support as well to take patients and the companions. This needs to happen, and that would also be relieving a little bit of this stress currently happening actually at all the hospitals, the partly functional hospitals still in Gaza. So coming back, some of the operations, some of the treatments, which maybe in the past could be provided in Gaza, at the moment cannot be provided in Gaza, or not in the place. There's no space for internal evacuation, and the external evacuation towards Egypt is, I would say, is not organized, is insufficient, and needs to be stepped up. Over to you.
Thank you. The sound was much better, so maybe we keep going. I would like to invite Christiane Ulrich from the DPI to ask the next question. Christiane?
There we go. Thank you, Fadela. My question to the team in Gaza is, can you tell us what concretely your contingency plans are for this offensive that we all expect and that has been announced to happen, we don't know when, but what exactly is WH doing at this point to make sure that in the case this happens, patients and casualties will be dealt with in the best possible manner? Thank you.
Dr. Peeperkorn?
Yeah, thank you for the question. It's incredibly complex. And first of all, we still, and I think all of us still believe, it should not happen. It absolutely should not happen. There's 1.6, 1.7 million people in a way too small place. There's no place to go. There's no place to go, and there is no place also safe in Gaza. Now, of course, hospitals, and we are trying to assist with that assessment. They're making plans, like what, for example, I made the point on Al-Najjar Hospital in Rafah. Their most complex cases, they need to refer to the European Gaza Hospital. The same, the IMC field hospital does the same thing. So what to do if they cannot refer those patients anymore? I mean, that's we discussed where if their hospitals will be besieged, and again, I want to stress, even if the hospital is not directly attacked, but if there are besieged and there's military activities around that hospital quickly becomes partly functional and dysfunctional. So where to go? Plans are made, but they are all ad hoc plans, and the plans are also, I just wanted that this is a desperate plea, because plans are, there are no plans. The plans are plans, but they are absolutely insufficient. They're absolutely insufficient to stem that stream of patients when this would happen. So yeah, contingency plans are being made, but these contingency plans will be completely insufficient when this would happen at in that scale what is announced. Absolutely insufficient. So again, the plea that this should not happen. Over to you.
Thank you. Thank you, Dr. Peeperkorn. Now that the connectivity is better, maybe Nina, if you want to ask again your question, because we were not able to hear the answer. Nina, are you still online?
Yes, yeah, thank you. Yes, I was asking about the Al Nasser Hospital, and I was hoping you could provide a little bit more detail on the situation there, if you have insights from people on the ground in terms of whether Israeli snipers have killed civilians in the courtyard itself, and also that about the evacuation orders, how that's proceeding, how concerned you are about the evacuation, if it's possible to evacuate safely there too, and also the lack of food and drinking water in the hospital.
Thank you, Nina. I think you have also some
Yeah,
connectivity
I'm not
issues.
sure if you got the details I provided initially, and I don't have them with me because Thanos had them with me on the current situation. So we also have a lot of difficulties getting the right connections and the right information for Nasser Medical Complex, although it is literally very close by. That's the situation now. What we know that indeed that civilians have been called to evacuate, which is already extremely dangerous, but also the hospital has been under siege or military activities around that for more than a week. We know that at least 10 civilians have been killed around the hospital compound, and some reportedly within the hospital compound. We cannot confirm that as WHO. We also never confirm like who. I mean, that's what we see. I think Teresa said it as well. We have a mandate to report on attacks on health. We are not a crime investigation organization. We don't attribute that. We report as good as possible the facts. We know that the northern gate has been demolished, and we also have been reported that two warehouses have been almost destroyed completely and put on fire due to the hostilities, and that would be also an enormous blow, by the way, to the health service. The access is obstructed. We wanted, as though we wanted to get the hospital already last 5 to get in, and those were denied. Today there's another mission request, and also it's nothing happens with it. We will continue to do and at the moment the last from the was that there's 4 patients. That's latest we get. We want to do a quick assessment, and then we will be able to review better. It's not only this hospital. You also heard about hospital PRCS over the last couple of days, etc. And that Nasser Medical Complex is a key hospital for the whole of Gaza, and specifically for the south. So we we cannot lose that hospital. So we call on all parties. We call on all party efforts to prevent this from happening. So hospitals again must not be militarized, nor outside, inside, wherever, etc. Hospitals are there to care, and this hospital is critically important. Over to you.
Thank you, Dr. Peeperkorn. Dr. Thanos, you wanted to intervene here?
Thank you. I just wanted to comment on the number of patients in details or breakdown. Right now, we know that in Nasser we have 402 patients. Out of them, we have 35 in dialysis, 18 in ICU, and 3 in neonatal ICU. We consider this situation really critical. Thank you.
Okay. Dr. Zakaria, anything else? Okay. So I think we will try to collect all the information at this press conference and send you the notes to journalists, because I know the sound was quite poor. So thank you for your patience. And I think we will close this press conference. Thank you so much, Rik, Thanos, Chris, for being with us from Gaza. And sorry for all these connectivity issues. And thank you, journalists, for joining us. We will do our best to send you as quickly as possible the notes that our colleagues gave you this morning. So thank you very much, and see you in another press conference. Thank you, Dr. Zakaria, Rik, Thanos, and Chris. And see you next time. Bye.
Thank you very much. Bye-bye.